The number one job in the entire state is not retail, it's not folks working in shops, it's personal care services. Why? It's because it's a jobs program for the state. Almost 500,000 people in that state are being paid to carry groceries upstairs for their parents or for their neighbor. Again, these are jobs your family would do for you. That creates jobs in a state that's losing jobs. That generates tax revenue, but it comes from the federal government because we pick up most of the tab.
Pure MAGA gold. Dr. Oz went on Fox News and started attacking home health workers. That's right. According to the Trump administration and many right-wing voices, if you are an older person or someone who needs extra help, you are now being treated like just another burden on society. We're going to look at these disturbing comments Dr. Oz made on Fox News, and I also want to share my thoughts on everything that was said. So let's get into it together.
So this is primarily about allowing the American people to have integrity within the healthcare system. And again, with Medicare and Medicaid, there's a handshake agreement we have, especially when we start offering services that are designed to protect you because your family is not doing them for you. I'll give you one concrete example. New York State, where you are right now, the number one job in the entire state is not retail, it's not folks working in shops, it's personal care services.
And these services help people remain in their own homes instead of being forced into nursing homes. I saw this personally with my grandfather. He lived to be 100 years old and never had to move into a nursing home because, during the final years of his life, he had home health aides who came in and helped him with different daily tasks. Because of that support, he was able to stay in the comfort of his own home instead of ending up in a nursing facility. And millions of other families across the country rely on these same services for the exact same reason.
Why? It's because it's a jobs program for the state. Almost 500,000 people in that state are being paid to carry groceries upstairs for their parents or for their neighbor. Again, these are jobs your family would do for you. That creates jobs in a state that's losing jobs. That generates tax revenue, but it comes...
That is the kind of work families would normally help with. But what happens when someone does not have family around? What if they have no relatives living nearby? What if they never had a family to begin with? And what about people who never got married or never had children? If there is nobody there to take care of them, then what happens to those people? Are they just supposed to be abandoned and left to struggle on their own?
From the federal government, because we pick up most of the tab. And here's the part that's really bothering me. They're starting to unionize these workers, which means now we're paying union dues. Now that goes back to support the political patronage that, unfortunately, in the case of New York, is being supported by one party.
Dr. Oz, it's amazing. A producer of mine was on the subway and saw someone researching home health care on their phone here in New York City. Surprise, surprise. Thank you for your hard work. All right.
So Kayleigh McEnany, or whatever name she is going by today, claimed that she or her producer saw somebody researching home health services, and she talked about it like they were searching for something illegal. Since when did home health care become controversial? And honestly, I already know the answer. The Trump administration, MAGA supporters, and right-wing figures like Dr. Oz seem to believe that unless you are a multimillionaire who can afford everything on your own and never rely on any kind of public service, then you basically do not matter. That is the attitude they push. This is genuinely the first time I have ever seen home health care treated like some kind of scandal. Let me know in the comments if this feels just as insane and new to you too. We are talking about people who are 70, 80, 90, or even 100 years old and physically can no longer take care of themselves. Some of them have no family nearby, and even when they do, many families are busy working just to survive. That is the reality for millions of people trying to balance their own jobs while also caring for elderly parents. People are already trying to raise their own children while working full-time jobs, which means many families simply cannot also provide full-time care for an elderly parent or grandparent by themselves. That is exactly why programs like Medicare and Medicaid exist to help provide home health services. But of course, Dr. Oz and many of these other ghouls in the Trump administration do not want a single cent of money going toward helping ordinary people. That is the reality of what this is really about. And honestly, this clip is not getting enough attention, which is why I wanted to talk about it on my channel because the comments were genuinely disgusting and infuriating. At this point, surprised is probably not even the right word because this administration, along with much of the modern right, has been attacking regular working people and older Americans for years. We saw it clearly during the pandemic when many of them openly pushed the idea that grandparents and older people should basically sacrifice themselves for the economy. To these people, Nothing matters more than money. Your life, your parents' lives, and your grandparents' lives mean absolutely nothing compared to protecting wealth and power. Meanwhile, Dr. Oz already has more money than most people could ever dream of, yet people like him still act as if helping vulnerable Americans is somehow the real problem. And honestly, if it were not for the insurance lobby and all the money tied to it, they would probably be attacking insurance coverage too. Dr. Oz sounds like the type of person who would say, if your house burns down and you need insurance to cover it, then you should have saved enough money to buy a brand new house yourself. Or he would probably tell people to just go stay in their beach house or mountain home because that is what someone rich like him would do. That is the mindset people like Dr. Oz, Trump, and many others in the Trump administration seem to have, and honestly, it is completely disgusting. And just the other day, Trump openly admitted that he does not really think about the financial struggles of ordinary Americans when it comes to his negotiations with Iran. According to him, the only thing that matters is stopping Iran from getting a nuclear weapon. If Democrats were politically smart, and honestly that is still a big question, they would already be turning those comments into non-stop campaign ads for the midterms. They should be showing Donald Trump's own words over and over again, admitting that he does not think about or care about the financial pressure ordinary Americans are facing. It feels like one of the easiest political ads imaginable. But unfortunately, I honestly do not know if Democrats are smart enough to take advantage of it. Donald Trump, Dr. Oz, and many of these other figures in the Trump administration are practically handing upcoming elections to Democrats on a silver platter with the things they keep saying publicly. And yes, I know there is gerrymandering and all kinds of political games involved, but these comments should be so unpopular that none of that should even matter. The backlash should be overwhelming. It should be the kind of result where the margin is simply too big to manipulate or twist. That is what many people believe needs to happen in the United States, an overwhelming response from voters so massive that even Trump and figures like Dr. Oz cannot find a way around it. But honestly, it is still unbelievable hearing the kinds of things these people are willing to say out loud. Let me know in the comments what you think about all of this. Is there actually anything controversial about home health care? I mean, almost everybody watching or listening to this video probably has a loved one, a family member, a friend, a grandparent, or a parent who has needed home health services at some point because they were no longer able to fully take care of themselves. And in many of those cases, home health care allowed them to stay in their own house or apartment instead of being forced into a nursing home. But apparently, in Trump's America, needing that kind of help somehow makes you a loser. So let me know what you think in the comments. And seriously, do Dr. Oz and Kayleigh McEnany actually think they are making a good point here? Is using home health care somehow a bad thing now? Is it bad that home health services also create jobs in states where employment opportunities are already declining? Dr. Oz was literally criticizing the idea that these programs create jobs. Since when is employment considered a negative thing? Apparently, in the world of Donald Trump and Dr. Oz, even people who work for a living are treated like moochers and losers. Let me know your thoughts in the comments, and make sure to like the video and subscribe for more content like this.